we are fortunate to be at this groundbreaking ceremony for the renovation and expansion of the Morant Bay Health Centre. I'm very proud of the Health Ministry that is now making a change to the healthcare and the quality of life of the people of St. Thomas.
We're here to celebrate another positive development for health and another positive development for the parish of St. Thomas. What we are embarking on now is part of our overall strategy of the government to see primary health care as a priority. Presently, we have undertaken 129 health centers, either build or refurbish and expand. We recognize that part of the strategy of primary care must be to ease the pressure on secondary care. We talk about our hospitals, the waiting time, the number of persons going to hospital, the number of persons going to the accident and emergency areas of our hospital. The answer to that is having in place an excellent, robust primary care system. The Morant Bay Health Centre, which is now seeing 2,763 patients per month. When we expand, we expect that those numbers will also go up. But persons in license in Johnstown, Dumfries, and further back can literally walk to clinic. That is what we are encouraging. By virtue of the expansion, again, if you are being referred from the hospital to the health center, easy walk. From the health center to the hospital, easy walk. And so I am saying that what we are doing is planned strategic work.
This facility is one of 17 centers that serve the residents of this parish and is also the largest health center in terms of number and services provided. This renovation and expansion project is an example of how we have been assessing our facilities, identifying the weakness and taking necessary steps to address them. We recognize that the Morant Bay Health Centre has outgrown its current space, inclusive of the population. So this project will address the problem as well as improve the general layout for our health centre. Southeast Regional Health Authority is on a mission to improve all our facilities. One by one, we're trying to transform them into first-class healthcare institutions.